Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips and Practical Tips. Today, I'm going to also continue talking about the other margin that we evaluate in the case of colorectal carcinoma or resection, which is the axial or longitudinal margins. And these are both ends, the proximal and the distal margins of any colorectal resection specimen. This is also sometimes, remember that with colorectal carcinoma, the surgeons tend to send what is known as a donut, which is yet further margin, further axial margin beyond what was resected. So when do we evaluate both margins? Do we have always to submit both margins for histological examination? And the answer is no. We usually submit those margins if the tumor is less than 30 millimeters or less than 3 centimeters from either of the margins. If after histological examination there appears to be infiltrative growth pattern of the tumor, extensive lymphovascular invasion, or the tumor is of an aggressive nature, signet carcinoma, undifferentiated carcinoma, neuroendocrine carcinoma. Apart from these conditions, the Royal College of Pathologists actually does not recommend submitting the axial margins and the donut margins. However, in general, in practice, people tend to submit those margins for histological evaluation. Now, this is a case of rectal carcinoma that received neoadjuvant treatment, and this is actually the donut. It's not even the axial margin or the longitudinal margin. This is the extra donut that was sent by the surgeon. And as you can see in the submucosa, there is a pool of mucin with tumor, viable tumor cells. Now, in this instance, we consider the axial margin positive, which would indicate a higher chance for recurrence of the tumor. Remember that involvement of the margins would mean incomplete surgery and does not alter the pathological stage. Remember this very well. So whether this is the circumferential margin or the axial margin, being positive means that the surgery is incomplete, which associated with increased risk of recurrence, but does not alter the staging of the tumor. I hope you find this tip useful in your daily practice. Thank you.